I'm Dr. Noelle Larson, and I work at Mayo Clinic in Rochester, Minnesota. I'm an orthopedic surgeon with a specialization in pediatric spine surgery. First of all, I tell people to try and be relaxed as you can. It's normal to be nervous going into scoliosis surgery. You've probably never had a big surgery like this before or been through a big medical encounter. But the good thing is there's many other children and teenagers just like you that have been through this, and we've got them through the procedure, and it's, again, wearing a brace or worrying about surgery is this long, long course, and the surgery is a big impact on your life for a short period of time, and then it's over. So I'd say just try and collect a few things that you'd like to take with you to the hospital, a few loose-fitting clothes. Sometimes people prefer to be in their own clothes rather than the hospital gowns, if you like. I think a pair of shoes is nice. And then I'd develop a playlist or music that you like to listen to and bring that with you to the hospital to help you relax and get through the event. So for the day of surgery, we ask you to come to the hospital usually about 6 o'clock, 6:15 in the morning. Typically, in my practice, we meet with patients and families the day before surgery and go over all the instructions and tell you everything that you'll need to know. In the morning, don't eat anything. You can brush your teeth, but I would spit out anything and don't take water or medications unless you've been instructed to do so. And basically, you come in about 6 o'clock in the morning and the nursing team checks you in. They'll have you put on a hospital gown. They'll ask you your name and your date of birth. And then usually around 6:45, 7 in the morning, we will typically give people some sedating medication. So at that point, when you actually drive back to the surgery area, you're typically pretty relaxed and maybe even asleep, and certainly aren't concerned about the situation anymore. Typically, the anesthesia team and I will come in and talk with your parents in the preoperative holding area and go over any last-minute questions that may have arisen. Operating room is what we call a sterile environment, so people wear special clothes and special precautions are taken not to introduce infection. So for the most part, at our center, our procedure is typically to give children that sedating medication that makes you sleepy and tired, and then typically go back to the surgery area alone. In some instances, we'll have the parent change into a hospital jumpsuit, and then they will be able to go back to the surgery area with the child. But for the most part, the children are usually pretty asleep before we even drive back to the operating room area. But understandably, that's a tough moment, and it's a tough moment for the mom and the dad and the child, and being separated and going back to the OR. But the good news is, as the child, you'll go to sleep, and then you wake up as if no time has passed. For the most part, we do not need to use blood transfusions for scoliosis surgery. In rare instances, it still can be a possibility, so we always discuss this question before the surgery. There's several things we do. We give a medication during the surgery called tranexamic acid, and this reduces the amount of blood loss during the procedure. Also, we have equipment where we can take blood from the surgical area, wash it, and then give it back to the patient through their IV, which is a little tube in their arm. And those two procedures have really cut down a lot on the blood loss for scoliosis surgery, and as a result, blood transfusion is quite rare.